Hey there, welcome. If you enjoy educational content about sex, sexuality, and relationships that inspires and informs, be sure to like this video and subscribe to the channel so you don't miss what's coming next. Also, please drop a comment to share your thoughts and questions. Hi, and welcome back. This is part 4, the fourth and final part of my series, Talking About Sex Issues for Helping Professionals. My name is Martha Kauppi. I'm a marriage and family therapist and an ASEX certified sex therapist. And today's episode is called Magical Therapy. What's possible when we overcome our avoidance and our clients' avoidance of talking about sex? In this series so far, we've been talking about why it's important to discuss sex issues in the therapy room or in the course of our regular work as helping professionals, what we miss when we avoid the topic, and how to get down to it, even if we're a little uncomfortable. Now, I would like to flip this completely around and look at the other side. What can happen? What opportunities emerge and open up when we decide to talk about sex issues in therapy? Well, you can give your clients an instant and simple reparative experience that counteracts sexual shame just by being in the conversation in the first place. And this is huge. So really, I invite you to just breathe that in. You don't have to know anything about sex except that we're not broken and being in the conversation is important. So if you're able to do that, you're already really, really ahead of the game. Now, if you're also able to provide some accurate information because you maybe have gotten some extra training somehow, that's especially amazing because there's a lot of reparation that comes from learning that we aren't actually as broken as we've assumed about sex. And so here's what I want to say about that. We're never broken about sex. So this is really beautiful. And, if you don't have a lot of training about sex, so it's hard for you to say that with confidence, here's a hot tip. Nobody's broken about sex. Sex is complicated. Sometimes it goes well, sometimes less well. Some want more sex, some want less sex, some want no sex. Some have problematic experiences around sex. Many have some kind of challenge about sex. Bodies change over time, and bodies have a whole lot to do with sexual experiencing. And still, I say, nobody's broken about this. My job is to help people with the challenges they encounter, sexual and otherwise. And a great starting place is, let's talk about it. And where do you want to get to about this? You're not broken. So if you start from the operating assumption that you are not broken, what would you like to experience? What's possible for you that would be meaningful to you? My job is to help you think about that and maybe take a step or two toward it, and then let your experience be your teacher. And I'm here to help. So imagine how many people would really experience a huge change just from you saying, I'm really confident you're not broken about sex. And many, many people, maybe even most people, think they're broken about sex. Okay, so here you are talking about sex in your work, I'm imagining. Maybe you haven't done it yet, that's okay. But I'm just gonna come in as if you were. So you can listen to the client's story and you can ask some questions. And in so doing, you're going to discover important aspects of this particular case or situation that need to be addressed in order to make some progress. Without opening the topic of sex, you are undoubtedly missing a lot that the clients don't even know is relevant. Maybe they don't know that it's something that could be improved. Sex pain is a heartbreaking example of that. Lots of people don't know that having unwanted pain with sex is something that actually can be changed and that we shouldn't take for granted as just part of the experience. Who would want bad sex or painful sex? Nobody. So this is a good time to acknowledge that many couples therapists have been taught that working on communication or couple skills or relational connection is going to automatically result in improved sex. I can tell you that isn't true. Once in a great while, maybe, with clients who have a lot of capacity for relationships and not a lot of sexual shame, and additionally, not a lot of misconceptions about sex. But for the vast majority of clients, there's some kind of misinformation about sex or sexual shame that's presenting a big block. So consider, for instance, how many people do you know who can say what they prefer about housework, but they can't say anything about what they want sexually? I rest my case. So directly talking about sex increases people's capacity to talk about sex directly. If your clients aren't doing that yet, you can help. And also talking about sex frankly often increases motivation for shifting systemic dynamics between partners. So sometimes it can be hard with a couples therapy or an individual therapy about relational dynamics to get traction. And if there is a sex issue, sometimes that can provide motivation. For instance, a common situation is where there's a desire discrepancy. One partner is strongly desiring more sex and the other partner less. And this is creating some tension between them. Probably one partner feels pressured in that situation to have sex. Either they're pressured by their partner or they're experiencing internal pressure. The right thing to do is, I'm broken if I don't. When you have that experience of feeling pressured for sex, that very reliably decreases desire. And if that's the case, the higher desire partner is going to have more motivation to work on the dynamic of pressure when they know that it's literally blocking them from getting what they want. I will say, I don't know where we'll get when your partner doesn't experience any pressure for sex. But what I can tell you is you're not going to have more sex until you run that experiment. So that's an important aspect. And my example of sex pain is another one. Sex pain very reliably blocks desire. Of course, that makes perfect sense. And if you don't know that sex pain is not normal, and if you don't know that sex pain is treatable, then you're missing the boat. So here's a place where as soon as you learn that, newsflash, you just did, you can help your clients who are experiencing pressure for sex or unwanted pain with sex get a shift just by saying, I'm pretty sure that actually kills desire. Let's see where we can get with that if you want to experience more desire. And from the Department of Not Broken, if you don't want to experience more desire, that's okay too. So really imagine, what would it be like for you to feel confident and competent in this area? Wow, it'd be amazing. You would be talking about sex in the course of your work as if it were, I don't know, a normal part of life. Wow, so much healing is possible there for you as well as for your clients. I want to share some accounts from therapists just like you who started talking about sex in therapy. And I want to do this because thousands and thousands of therapists have gone before you, started from not comfortable, not knowing a lot about it, feeling like it's a big risk, and doing it. And I want you to know something about what they experienced. So here's one therapist's words. My religious upbringing made talking about sex taboo, and I really felt I was invading privacy if I brought it up. I've used Martha's line, quote, I'm taking a course on sex issues that come up in therapy, and I realize we've never really talked about it. And when I said that, most couples seemed relieved by the question. Only one couple has told me, in the many I've asked since, that they don't want to talk about that in detail here. I just told them, okay, thanks for letting me know. If that changes, please know I'm willing to discuss any issues that do arise. I find it gets so much easier every time I bring it up. Wow. So that could be you. Here's another one. Quote, I learned clients were much more comfortable talking about the details than I ever thought they would be. In fact, I had to do some self-talk at first about staying steady so I was able to hear their answers, as I wanted to welcome the truth, and it was information I wasn't used to collecting. That is a really common experience, to have to kind of recalibrate to hearing explicit conversation and participating in an explicit conversation when it's brand new. So again, practice, the Department of Practice. I personally have devoted my career to training generalist therapists to work with sex issues. This is important to me because just about everyone has a sex issue at some point in their life. And if we needed a specialist to work with every sex issue, what I can tell you is there are not nearly enough of them. Most of the sex issues I treat as a therapist do not require a specialist. They just require you, for instance, a therapist or a helping professional who's willing to talk about hard topics with clients who need some help. I've seen so many therapists start from zero training, zero confidence, and develop significant skills, and even open up entirely new areas of their practice. This is actually doable. Think about it. As therapists, we already, and honestly, all helping professionals, I know this is true of you too, we already talk about all kinds of sensitive material, like self-harm, addiction, abuse, suicidality, trauma. And we know how transformative and reparative it can be to open the door to honest conversation about really complicated topics. Why in the world wouldn't we talk about sex? Here's the Department of Good News, Bad News. And also, I have something for you that's going to make an enormous difference. So hang on. So here's the bad news. The truth is, you do actually need to have some information about sex and sexuality in order to do a really good job. And there's good news. I have a very simple 6-question assessment. It's free. You can use it to help sort out all the information that you get. You can use it to guide your assessment, prioritize your treatment plan, and figure out what you need to refer and to whom. I call it Will Lilly because I remember it using a mnemonic device. There are 6 questions that I've languaged for you, and I remember the questions and the order of the questions through a mnemonic device. Will Lilly pick Andrew or Sarah? So the first question starts with a W or is about a W topic. The second question, L, etc. Learning this simple, effective tool takes about 10 minutes, and then you can use it forever. It also comes with an infographic that you can tape to your clipboard and a follow-up infographic. So you don't even have to memorize it. And again, it's free. So what people have had to say about Will Lilly, the assessment tool, is, here's a quote, I included the questions in my intake process a few months ago, and they've been magic. They've been the key to opening the topic in a very natural way. Starting with me as a therapist using this language has supported my confidence, and as a consequence, my clients feel allowed and welcome to discuss their issues. Beautiful. You totally can do this. So if your main question at this point is how to guide the conversation and make sure you don't miss something important, the Will Lilly Brief Assessment is exactly the answer to that question. Again, it's free. And the reason that I offer this mini course and this assessment tool free is because I want every therapist and helping professional to talk about sex in the course of their work. And I think most of us have no training in that area and need a little boost. So consider me the boost. So this assessment tool comes with a video that walks you through all 6 questions, some follow-up questions, how to make a referral, all the things. So it's important to watch the video. And then there are 2 infographics that make it so you don't have to memorize anything and you can use my exact language. Of course, you can also use your own language, but if you don't want to, just use the language that I've honed over the course of many years. Ask the necessary questions. And the video is going to help you know what to do with the information you get. And then from there, you can use the resource list I've provided or some further training to help you take your next steps. And if you really get stuck, you can always make a referral to ideally a certified sex therapist, and you can find them on asect.org, AASECT.org. So as we come to the end of this 4-video series, first of all, think back to the very first video when I asked you where you were hoping to get with this, what you were hoping to experience, and why that was important to you. I'd like to invite you to just do a little self-assessment. Where are you along the journey? How clear are you on what you wanted to experience then, why it was important, and have you moved in that direction? Whatever it is, go back and find your notes, because whatever it was important to you when you watched the first video, and I want you to be able to get there, whether it's about talking about sex and therapy or not. And you can do this again now that you're 4 videos further in. What do you now want to experience? And what might be a good first step or next step to moving in that direction? Perhaps downloading the mini assessment, Will Lilly, so that you can ask all the questions you need to ask and get the conversation moving. If your client says, yes, there is something about sex, then what, right? So I've got you. I want to thank you for your courage, curiosity, and willingness to explore the topic. Good for you. It is amazing that you're here. Just by learning a little more about why sex is important and why you should be bringing it up rather than waiting for your clients to, why the stakes are high and the payoffs are higher. And thank you for learning about what impact it can have when you decide to either discuss or not discuss sex in the course of your work. What a rock star. Thank you for being here. I hope very much that in the end, you'll join me in my effort to co-create a world where every client can easily find a helping professional who's comfortable, confident, and competent working with sex issues. Thank you so much. Thanks so much for watching. If you found this helpful or inspiring, please give it a like. If it brought up some deep thoughts or new questions, that's great. Please leave a comment or a question. I'd love to hear from you. And if you want to make sure you're always part of the conversation, hit subscribe, and I'll see you soon in my next video.